June is Migraine Awareness Month, and as anyone who suffers from them knows, migraines can be truly miserable. Dr. Christina Captain, lead practitioner of the Sarasota Center for Acupuncture and Nutrition, is here to offer some help. It is great to see you.
That's so good to be back.
Physically, what defines a migraine?
Well, you know, it's interesting. This is this throbbing, unrelenting pain in your head, of course, sometimes on one side, known as unilateral, or it can be on both sides, accompanied by a loss of function, like you can't function in your day, right? And then also accompanied by a nausea and even vomiting.
So when someone comes to you and describes that they have been experiencing this, let's assume by the time we reach out for help, it's been more than once or twice. What can you do? What do you say to them?
So first of all, we want to make sure that you understand that it is a clinical diagnosis. There's no imaging. You can't do an x-ray or an MRI or a blood test to say, yes, you're diagnosed with migraines. And if you look at the Mayo Clinic website, they define a migraine as a genetic neurologic disease. So when we think about this, it's not something someone can push through. People say, oh, you just have a headache, you know, just get over it, like just deal with it, go lay down, just come on, we got to get through this. That's not the way to go with migraines. Migraines are severe, they are classified as a disease, and there's plenty of ways to help. So once people come in and they say, you know, I've been experiencing migraines, or I've been diagnosed with migraines by my primary care physician or my neurologist, great, let's try some alternative therapies. So we know the prevalence is huge in women, right? It's what, 3 times higher, right? 1 in 5 women versus 1 in 16 men, and even children can have migraines. 1 in 11 kids suffer from migraines. You know, and this can really disturb your day-to-day function, from sports to school to daily life, being a mom, you know, being a dad, working. You can't come in, I can't function. A lot of times there's visual disturbances and auras, ways that they're temporary, and they go away, but they're disturbing to your whole day, right? So what do? Well, we look at all the things that can cause migraines.
Okay, so you start at maybe choices we're making in our lives?
Well, it's not your fault. It's not people's faults they have migraines, right? Because again, we're going back to a genetic neurologic disease. However, there are things that can trigger them and things you can do to make it easier on you to manage, right?
Got it.
So first of all, sleep is a big deal. Migraines can interrupt sleep, but adequate sleep helps prevent migraines, right?
Makes sense.
Exercise is a big deal. So we know exercise is great for everything, but exercise in moderation for migraines has been shown effectively in research to help. Eating processed foods, sugar, red wine. God, I hate that.
Point at me?
Oh, I hate that. Too much caffeine.
Oh,
right?
Interesting.
Processed foods, sugars, yeah, all those things are going to mess up. So clean eating triggers. So clean eating is going to work much better.
So you're educating people as the first step.
On all of that, right? And then stress. So what do we do at the Sarasota Center for Acupuncture and Nutrition? Obviously, we're going to change you and counsel you on lifestyle. We're going to also provide you modalities such as acupuncture to help you combat and manage these migraines.
Okay.
And so we know that already acupuncture works for stress management. It works for pain management. So I have had patients come in with migraines they've had forever, and boom, some acupuncture, some lifestyle changes, boom, they're better. They get rid of migraines forever.
So that goes down to, and I love to talk about this now that I've experienced acupuncture with you, that there are certain pressure points that certainly help relieve stress, but do they also help relieve the flow of the blood and the pain?
So acupuncture is a complicated system anymore, because we know that research is being done about all sorts of things with acupuncture. We know that acupuncture balances serotonin and dopamine in the brain, neurotransmitter chemicals. We know that it helps the immune system. We know it balances hormones. One of the major triggers for migraines are hormones, thus the prevalence in women.
It's always something.
So we have hormones during menstrual cycles, we have hormones during pregnancy, we have hormones during perimenopause. It's like, yay, we're women.
Yay, we won the female lottery.
I love being a woman, but still, this is a problem for us with hormones. So we know acupuncture helps to balance those hormones. And stress relief, insomnia, sleep issues. If people would come in more frequently, that's when they get effect for change, right? The other thing we do that's different, though, is we look at targeted nutritional supplementation. We say, hey, what's missing after a big course of an intake, and really understanding what's happening with that patient on a day-to-day basis across a variety of symptoms? We're looking at nutritional deficiencies, targeted nutrients that could effectively mitigate migraines. I mean, of course, you can go and you can get, acute care from your physician, and you can have chronic medications and even IV infusions for migraines. But people, that doesn't need to be your first course of action if you have an alternative. Try something, or try it in combination with those and with your physician's help, and then we can decide if you can maybe avoid those medications. Because doctors don't want you on medications. They don't want to have to treat you that way.
No.
They want you to be able to live your life freely, but they're there in case you need them, and that's the key with medication.
And I think that's so great about what you do with the alternative medicine is it's truly an alternative and an addition to other treatments that can be used. So if you are a migraine sufferer, know that there are options for you, and that's what Dr. Captain is all about. To find Dr. Captain and her team, no matter what pain you are suffering from, you can find her by going to scansrq.com. We'll be right back.